Okay, thank you. And these are my conflicts. And the background goes back over half a century. Conjugated equine estrogen introduced in U.S. clinical practice in 1942. After a half century, however, the effects of estrogen alone or estrogen plus progestin on breast cancer still remain controversial. I'm citing these two recent Lancet publications, one of which is a meta-analysis of 58 observational studies, and the Million Women study, which entered 37% of postmenopausal women in the United Kingdom, and both suggest that both estrogen plus progestin and estrogen alone significantly increase breast cancer incidence and significantly increase deaths from breast cancer. Against this background, we present the results from the two Women's Health Initiative hormone therapy randomized trials. These trials were begun entered patients between 1993 and 1998, women between the ages of 50 and 79 years of age, no prior breast cancer, with a mammogram not suggestive of malignancy. Postmenopausal women with prior hysterectomy were randomized to conjugated equine estrogens or placebo. Women who had an intact uterus, at that time it was known that endometrial cancer risk was associated with women with estrogen use in women, so the progestin blocked that, so we used conjugated equine estrogens plus medroxyprogesterone acetate versus placebo. The primary monitoring outcomes for the study were coronary heart disease for benefit and invasive breast cancer for harm, and you'll see these paradoxical results, at least in the estrogen alone trial. So this is a randomized placebo-controlled double-blind study implemented at 40 U.S. clinical centers. Annual mammograms were protocol mandated. Breast cancers were verified by medical record review, and deaths were verified by central death certificate review. And importantly, we use the National Death Index, which captures 98 to 99% of deaths, regardless of women's consent to continue to be followed or drop out. So our mortality findings are really absolutely complete. Here's some of the baseline characteristics. Call your attention to the fact that over 20% of the women were entered between the ages of 70 and 79. They're a little heavier than the population at that time. Currently, the U.S. population, 40% of postmenopausal women in the U.S. are obese, and you can see it was a little higher in the CE alone trial. And about half the women had never used hormone therapy previously. So here's a summary kind of the results, and what we can see is the solid blue line is the estrogen alone outcome for breast cancer incidence, and the faded blue line is the control group who received placebo. The faded red line is the control group for the estrogen plus progestin trial, and this is the estrogen plus progestin finding. So you can see that CEA alone, after use for 7.2 years, now with 19.2 years follow-up, resulted in a 23% reduction in breast cancer incidence, which was statistically significant, whereas the CE plus MPA ended up increasing breast cancer by 29%, again, statistically significant. We like these curves because they show each dot is a cumulative hazard ratio. The confidence intervals are the vertical bars, and the standard deviations are indicated on the right. So it looked like estrogen plus progestin was reducing breast cancer for the first 5 years, but we have subsequently evaluated and published in peer-reviewed journals in JAMA that actually was a delay in diagnosis interfering with breast cancer mammography. But you can see after 5 years, there is an elevated increase in breast cancer. The use of the drug was only for 5.6 years, but you can see that the increased use above the level is continuing for up to 20 years. So a woman takes estrogen plus progestin for 5 years, and she is exposed to a 20-year risk of increasing breast cancer risk. And you can see it doesn't seem to be leveling off, so one could speculate it will be a lifetime risk for short-term use. Here's a comparable plot looking at CEA alone and breast cancer incidence. And here you can see this is the incidence goes down quite rapidly and stays down. The use here was for 7.2 years. That's the green segment. And what happens is after that use stopped. You can see it went up just a little, and it's staying significantly lower now through 20 years of follow-up. So use of estrogen alone in this population, again, which is a kind of older population than normally used for vasomotor symptom management, results in a statistically significant reduction in breast cancer incidence. Now we'll look at some subgroup analysis. You direct your attention to the right-hand panel, which is the CEA plus MPA trial, looking at breast cancer characteristics. And you can see for, regardless of histology, receptor status, that in all categories, CEA plus MPA resulted in an increased number of breast cancers. And you can see the deaths from breast cancers were increased in the bottom line by 45%. That was of borderline statistical significance. The deaths after breast cancer were statistically significant. If we move to the right panel, we can see that, interestingly, that estrogen CEA alone use decreased, significantly decreased by 55% the frequency of estrogen receptor positive, progesterone receptor negative cancers. These are poor risk cancers. And then we see in the bottom, we can see that deaths from cancer were significantly decreased. So we show this in the breast cancer mortality findings expanded here. So we look first on the left-hand panel, deaths from breast cancer. For CEA plus MPA, we talked about a 45% increase of borderline significance, but CEA alone used a 44% reduction in deaths from breast cancer. Should call your attention to the fact that none of the approved agents for breast cancer risk reduction, tamoxifen, raloxifene, or the agents that have randomized trial support for their use, aromatase inhibitors, have been able to demonstrate a reduction in deaths from breast cancer. So this is a very, very unique finding. And then we look at the deaths after breast cancer. This is deaths from all causes after breast cancer, and it was increased in the CEA plus MPA use, but again decreased in the CEA alone use. So this is oops, I put it back. So this plot looks at follows a number of things together. So the blue line is the year-to-year influence of estrogen alone use on breast cancer incidence. The open circle is the year-to-year use on deaths from breast cancer. You can see they very closely track. Here we're going to look at the breast cancer incidence on E plus P, which you can see it goes up and stays elevated. And then these are the deaths from breast cancer. You can see they're elevated, but many more of the cancers in estrogen plus progesterone were not associated with mortality risk. So our conclusions, again, summarizing these 27,000 women followed for 19.2 years in less than 7 minutes, are that use of CEA alone and CEA plus MPA have opposite effects on breast cancer. It's pretty clear when you saw that last slide that they're both going in opposite directions, and surprisingly, effects of short-term 7.2 or 5.6 years of use seem to have effects that are maintained through at least 20 years of follow-up. CEA alone significantly decreases breast cancer incidence and deaths from breast cancer, which persist over decades after discontinuing use. CEA plus MPA significantly increases breast cancer incidence and associated mortality, which persists over a decade after discontinuing use. These findings, in conjunction with other hormone therapy effects and clinical outcomes, should inform clinical decision-making. Thank you.